Well, according to the American Cancer Society, breast cancer death rates have dropped by more than 40% over the last 30 years. But they find that black women are still 40% more likely to die from the disease. So what can be done to prevent it? And once diagnosed, what are the best courses of action to cure it? Here now to answer some of those questions is Oncologist Dr. Nkiruka Ezenwajiaku, and she's joining me now this morning. Welcome to the show.
Thank you for having me, Jawan.
Yeah, thank you for joining me. I'm just glad I got the name down. Thank you. So, okay, let's get right to it, because we talk about this every year, and the fact that black women are diagnosed with breast cancer less than their white counterparts, but have a 40% higher risk of dying from it. Why is that the case?
So you're right. You know, the incidence, the number of new cases of breast cancer is rising every year by 0.5%, but the death rate is stable. But when you look at the white versus black counterparts, there's greater than 40% chance of dying from breast cancer. And the reason why is that we are seeing black women present at a later stage. So we know that the earlier stages of breast cancer have a better outcome than the later stage when at the time of diagnosis. Black women are presenting at advanced stages when the cancer has already spread to the lymph nodes or even metastatic, where it has spread to other places. And the curative nature of those cancers become less and less. So black women are at a less, they are less likely to go for their screening modality. They are less likely to go to the doctors with symptoms. Mm-hmm. And more importantly, there has been a big, long-standing mistrust between black women and the medical community. Okay,
so stop right there. Let's get right now to this, because we got to make sure that we do what we can to educate all of the women out there, especially black women. And I want to know, what can they do to improve their chances of survival?
So what I tell my patients, my friends, and the community is, when you see something, say something. So when you feel, you know your breast better than anybody else. Yeah. So when you feel something is abnormal, do not wait on it. Yes, there is this misconception that there are some people who go to the doctor all the time, but discuss this problem with your doctors. So come earlier when you see a change in your breast. So those changes could be a lump. You feel a lump that wasn't there before. Or you see some changes in the color, discoloration of your breast, or some changes in the nipple itself. So nipple retraction, when the nipple sucks inside, or some nipple changes or some nipple discharges. Go to screening early. So know a little bit of when you need to start your screening at age 40 and things like that.
Well, you spoke about some of the I guess trust issues in the black community, because we have a lot of that when it comes to a number of things, especially healthcare. So does racism at all play a part in this?
I think the fear of racism, of course, plays a part in it. If you go way back to the 1930s, we all know about the Tuskegee syphilis project, where black people, even in the 1930s when that started, and then down to the 1940s when penicillin became the treatment modality, and we knew about that. These medications were not given to black people. So that long-standing mistrust of the medical community has been there for a while. And there are some retrospective, there are some studies that have shown that actually black people feel that they are treated less when they present. So an example is, people complain that when a black person goes to an ER, emergency room, for pain, they may not get the same quality of pain control compared to the white counterpart. So all of these things play a role in the black community with mistrust in the medical community.
Let's get to the pandemic, because the pandemic prevented many people from getting regular screenings, of course. So could that be a contributing factor in the rising number of breast cancer cases? It
is a contributing factor, because we are seeing more of these cases now, because people are now back to getting their screening modalities at a regular pace. But we are also seeing advanced cases now, because people presented later, given that they were not able to go to the hospital during the pandemic.
Okay, let's talk about men, because a lot of people forget that men are definitely in line to possibly get breast cancer as well.
Of course.
So what about the men out there? What can they do in order to avoid breast cancer? What should they do?
Okay, so I'm glad you brought this out because men think they can't have breast cancer. So if you take it a step back, cancer basically is a cell in your body that became abnormal. So men have breast tissue, so men can develop breast cancer. So when you look at the statistics, 1% of every breast cancer occurs. The incidence of breast cancer is 1% in men is 1% of the general population. So when we look at the number of new cases that occurred for breast cancer in women, there were over 280,000. When we look at the number of breast cancer that occurred in men in the United States, it was about 2,000. So it does occur. Now, what are the risk factors for men, right? So one is family history. So when I say know your breast, I also say know your family history.
That's right.
So if you have a family member that has breast cancer, you are at risk of breast cancer.
And a woman, like a female in your family.
Female and men. So if you've had a female family history of breast cancer, it does increase your risk of breast cancer in men. If you have gynecomastia, so men with bigger breast tissue do have an increased risk of breast cancer. Men with genetic predisposition, so there are some familiar genetic mutations that are inherited. So like the BRCA1 and BRCA2 do increase the risk of breast cancer in men. And then there are other syndromes, like there's a syndrome called Klinefelter, where a man inherits 2 X chromosomes.
Wow.
So usually a man is an X and a Y, but there are men that may have an X and a Y. That also increases their risk for breast cancer.
This is interesting. I mean, these are some things I didn't even know, and I've been covering this for a number of years now, so this is really interesting. Okay, what about the financial burden, of course, that comes along with battling breast cancer? Is there help out there for those people who are struggling financially?
So there is actually a lot of help. So we have this saying that actually a lot of foundation money goes to breast cancer research. First and foremost, there is help for screening. So people who do not have insurance, there are places that offer free mammograms. So the Florida Department of Health actually has a breast cancer and cervical cancer early detection program that helps pay for this mammogram programs for people who qualify. There is a freemammogram.org that has a center that you can go into, and you find centers that are close to you that offer this free mammogram. Then when it comes to when you're diagnosed with breast cancer, I would recommend that you get established in a big tertiary center, because one of the things that we see in University of Miami is that we have these patients who come to us and we offer them a multidisciplinary approach. In that approach, you have both a medical oncologist, a radiation oncologist, and a surgical oncologist that help co-manage the treatment. But we also have social workers that help us find foundations to help support these women to pay for the treatment. So American Cancer Society has it has foundations to help pay for treatment. So does Susan Komen have foundations. So there are a lot of resources for these patients.
Dr. Nkiruka Ezenwajiaku, thank you so much. Thank you for your insight. I learned something here this morning. Thank you.
Thank you so much for having me.
You got it.
Thank you.